So what the data suggests is that it is more transmissible, it is spreading more rapidly, and it is gradually becoming a dominant variant as far as COVID-19 is concerned, both in the US, in Europe, Singapore, and we are seeing more cases in India also. So it is causing more infection, possibly because it is more transmissible and taking over the older strains. But the data also suggests that it is not causing more severe infection, it's not causing more hospitalization, and most of the symptoms are predominantly of the upper airways like fever, cough, cold, sore throat, running nose, and body aches.
Sir, as of now, like COVID variant cases are also coming, flu, RSV cases are also rising. How to stay healthy in this particular season?
So this is the season when you will see viral infection, respiratory viral infections becoming more. Every year we see them, whether it's influenza, now COVID, and as you said, RSV and other viral infections. So, and that happens because of the temperature, because of crowding. It's a holiday season, people travel, so they will carry the virus with them. There is crowds, and many of the crowds are indoor because of the cold weather, and that leads to the spread of infection in a number of people. So I would say what we need to do is, first of all, COVID appropriate behavior. Wash your hands regularly. If you have cough and cold, cough into your armpit or into a tissue so that you don't spread the infection to others. Avoid going to crowded places, especially if you have fever, cough and cold, because you may be spreading the infection to others. And if you are in the high risk group, that is if you have comorbid conditions like diabetes, chronic respiratory diseases, chronic kidney disease, or heart failure, or you are in the older age group, then you should wear a mask if you go to a crowded place, or if you can, avoid going to an indoor crowded place because you can catch the infection.
Sir, as of now, do you think there is requirement of a vaccine which is variant specific if I talk about JN.1?
You don't need a variant specific vaccine. You need a vaccine which covers a broader, let's say, type of the virus. We have had multiple mutations. JN.1 is a sublineage of Omicron. So a vaccine which is made against Omicron will be effective against this variant also. But I think we need more data first to show what is the current immunity in the population and what is the protection that we are having based on the previous vaccination that we've got. Based on that only can we decide that do we need a new vaccine which covers the current circulating strain, and that is something that have to be done on a regular basis because variants will keep changing. So if we say that we need a vaccine against this, then it may be something that you will need another vaccine after some time. So we need to have data as to how frequently do we need to vaccinate and what would be a good vaccine which would cover a broader range of variants which are there or which may emerge in the future.